Very cool to watch. Over here, the dentist is removing the removable denture and replacing it by a fixed bridge. Now, this bridge is a fiber bridge basically made of polymer or plastic. It's stronger if you have it made of porcelain or ceramic, but it does cost a bit more too. So some people don't want to do that. Not to mention, in this case, they didn't shave down the other teeth where the porcelain needs a little bit of grip. So we have to trim the tooth a little bit. These kind of cavities usually happen when you do not floss in between your teeth. So in this case, the dentist has removed the decay and is preparing the tooth to have the filling done by etching the surface to making the surface of the tooth more porous, putting a bond on, which basically acts like a glue between the filling and the tooth surface, and now slowly putting in the composite, shaping it and making it molded to the surface of the teeth using a blue light to polymerize it, and then basically polishing it, and the filling is ready. No filling is as good as your own tooth structure, so what you want to do is floss your teeth every night before you brush to get the food out so your toothpaste can go in between and help keep the hygiene of your teeth. In this video, you can see that the dentist is placing veneers on the surface of the teeth. The veneers, as you can see, are very thin layer, and the tooth underneath has been slightly trimmed, but very slight. So it's not what you see online that they look like pegs or shark teeth. And this is it, voila! The only reason you would have this much buildup on the inner surface of your teeth is poor oral hygiene. You cannot blame it on anything else because this amount of calculus and buildup is not normal. We don't see it every day, although it's usually because of neglect. Now, this patient might have a very good reason, but because they couldn't get to the dentist or the hygienist to have them removed, and they probably wouldn't have a great oral hygiene routine at home, they would have this much buildup, which can cause gum recession, bone recession, eventually loss of teeth. Remember that your gum health is directly in contact with your overall health. Another amazing thing when it comes to implants compared to dentures is that you can easily bite into normal food. You don't have to worry about them coming out and displacing. With dentures, you have to remove them when you sleep at night. If you leave them in, your mouth will have fungus growing on it. With implants, you don't have to worry about that. You basically just treat it like your own teeth, floss and brush it, and that's it. On the other hand, partial dentures are great options if you want to replace a couple of teeth. You do have to remember to remove them when you sleep at night, and they are amazing options, especially if you're going to get implants done in the future and you couldn't get them done right away. Let's say you're doing it in 2 years' time. In the meantime, you have something that is very easy to remove and put back in. So here you go. Cavities on the side of the tooth usually happens because people do not floss their teeth and they have the food there for a while. The food turns into cavity and bacteria lives there. Now in this video, the dentist has cleaned out the cavity, drilled it out, and now is filling it. That's a matrix band on the side of the tooth to make sure the filling doesn't get stuck to the next tooth and you can floss. They are filling the area, they're going to polish it, and they're going to make sure that it's tooth colored. Although remember that composite fillings usually change color after a while, so you might have a bit of a brown spot there and have to change it every few years. Honestly, the main downside of having dentures, removable dentures, is that your bone underneath is shrinking every day because nothing is holding it together. Where if you had implants in, the implants would work like roots of a tree inside the soil, holding the soil together. So your bone keeps shrinking. That's why you see these granny videos where they sneeze and suddenly the denture comes out. There is no more bone left to hold the denture together.